Do you know the signs of vitamin D deficiency? It's a question worth pondering. Vitamin D, often called the sunshine vitamin, is an essential nutrient that plays a critical role in our health. Despite its importance, deficiency in this vitamin is far more common than you might think. It's a silent issue, subtly affecting our well-being without clear symptoms. But don't worry, we're here to shed light on this topic. In this video, we will reveal the top 10 signs of vitamin D deficiency. Vitamin D is crucial for our overall health. It plays varied and vital roles within our bodies. From the immune system to our bones, vitamin D has a part to play in keeping us functioning at our best. It helps our immune system to stay balanced during the cold and flu season, keeping us healthy and strong. But that's not all. Vitamin D also aids in the absorption of calcium, a mineral that's essential for our bone health. It's the silent partner that helps keep our bones strong and resilient, reducing the risk of fractures and osteoporosis. It's also involved in maintaining a healthy mood, which is why getting enough sunlight, a natural source of vitamin D, can often lift your spirits. But vitamin D doesn't stop there. It's also involved in cell growth, inflammation reduction, and neuromuscular function. So what happens when we don't get enough of this essential vitamin? Recognizing the signs of deficiency is the first step towards maintaining optimal health. As we delve into the first 5 signs of vitamin D deficiency, we start with a common yet often overlooked symptom: fatigue. If you find yourself constantly tired, no matter how much sleep you get, it could be a sign that your body is lacking vitamin D. This essential nutrient plays a crucial role in energy production, so a deficiency can leave you feeling drained. The second sign is getting sick often. Vitamin D is a key player in your immune system, helping to fight off viruses and bacteria that cause illness. If you're falling prey to colds and the flu more often than usual, it may be due to a lack of vitamin D. Next, we have bone and back pain. Vitamin D is vital for bone health as it aids in the absorption of calcium. A deficiency in this vitamin can lead to a decrease in bone density, resulting in pain in the bones and lower back. If you're experiencing unexplained aches and pains, it could be a sign that you need more vitamin D. Fourth on our list is depression. Yes, you heard it right. Vitamin D has been linked to mood regulation, and a deficiency can lead to feelings of sadness, anxiety, and in severe cases, depression. If you've been feeling unusually low, it might not just be a case of the blues, but a sign of vitamin D deficiency. Lastly, we have impaired wound healing. Vitamin D plays a role in controlling inflammation and fighting infection, both crucial for proper wound healing. If your cuts and scrapes are taking longer than usual to heal, it may be a sign that your body is craving more vitamin D. These are just the first 5 signs of vitamin D deficiency. Each of these symptoms may seem common and can easily be attributed to other conditions. That's why it's important to keep an eye out and listen to your body. But that's not all. There are more signs to watch out for. The deficiency can manifest in more subtle ways. That's what makes identifying vitamin D deficiency a challenge. Now, let's delve into the next 5 signs. The 6th sign is muscle pain. Are you often plagued by aches and pains in your muscles? This could be a result of insufficient vitamin D. The vitamin plays a crucial role in supporting muscle function. Without adequate amounts, your muscles may struggle to function optimally, leading to discomfort and pain. On to the 7th sign, hair loss. While losing a few strands of hair daily is normal, excessive hair loss is not. It could indicate a deficiency in vitamin D. This vital nutrient aids in the creation of new hair follicles, the tiny pores in the scalp where new hair can grow. So, a deficiency could potentially lead to thinning hair or even baldness. The 8th sign is bone loss. Vitamin D is essential for bone health. It helps your body absorb calcium, a key component for maintaining strong bones. If you're low on vitamin D, your bones may lose density, becoming fragile and more susceptible to fractures. Next, we have low mood or depression as the 9th sign. Several studies suggest a link between low levels of vitamin D and depression. This sunshine vitamin is thought to play a role in mood regulation and warding off depression. So if you're feeling unusually low, you might want to consider checking your vitamin D levels. Lastly, the 10th sign is increased susceptibility to infections. Vitamin D is known for its immune-boosting properties. It enhances the pathogen-fighting effects of monocytes and macrophages, white blood cells that are important parts of your immune defense, and decreases inflammation. Therefore, frequent infections could be a sign that your vitamin D levels are less than optimal. These signs are often overlooked, but they could indicate a serious deficiency. Remember, your body is a complex network of systems, and ensuring it gets the right nutrients, including vitamin D, is key to keeping it running smoothly. Ignoring these signs can lead to serious health complications. And make no mistake, the impact of long-term vitamin D deficiency is far from trivial. A vital player in our body's calcium management, vitamin D helps in maintaining the health of our bones and teeth. When our bodies are starved of this essential nutrient, our bones may begin to suffer. Over time, this can result in osteoporosis, a condition that weakens bones and makes them more susceptible to fractures. But the story doesn't end there. Vitamin D also has an important role in supporting our immune system and maintaining our cardiovascular health. A deficiency in this vitamin has been linked to an increased risk of heart disease. The heart, after all, is a muscle, and like all muscles, it needs a variety of nutrients to function optimally. Inadequate vitamin D can lead to high blood pressure, a key risk factor for heart disease. And let's not forget, vitamin D is also essential for the regulation of cell growth and for communication between cells. It's no surprise then that a deficiency can increase the risk of certain types of cancer, including breast, colon, and prostate. The risks of vitamin D deficiency are indeed alarming, but it's not just about the big diseases. The impact on daily life can also be significant. Fatigue, mood changes, muscle weakness, these are all potential consequences of a prolonged lack of vitamin D. It's a deficiency that can cast a long shadow over one's quality of life. Now, this might sound scary, but it's important to remember that these are potential risks, not certainties. Just because you're deficient in vitamin D doesn't mean you're destined to develop these health complications. But it's a risk factor, a potential piece of the puzzle, and it's one that's within our control. Fortunately, vitamin D deficiency is preventable and treatable. With a few simple lifestyle changes and, if necessary, supplementation, we can ensure our bodies get the vitamin D they need to keep us healthy and strong. After all, prevention is always better than cure. You can prevent and treat vitamin D deficiency. This is a powerful statement, and it's true. With knowledge and action, we can take charge of our health. Firstly, let's talk about sunlight. It's our body's most efficient source of vitamin D. When our skin is exposed to the sun, it naturally produces this vital nutrient. So aim to spend some time outdoors each day, but remember to protect your skin. Early morning or late afternoon sun is often the gentlest, and just 10 to 15 minutes can make a difference. Next up, let's discuss diet. Certain foods are naturally rich in vitamin D. Fatty fish like salmon, mackerel, and tuna lead the pack. Eggs, specifically the yolks, are also a good source. For vegetarians, mushrooms exposed to sunlight can offer a plant-based source of vitamin D. And let's not forget fortified foods. Many countries fortify dairy products, orange juice, and cereals with vitamin D. But what if you can't get enough vitamin D from sunlight or food? That's where supplements come in. Over-the-counter vitamin D supplements can be a reliable source. But remember, it's essential to consult with a healthcare professional before starting any supplement regimen. They can guide you on the right dosage and ensure it doesn't interfere with any existing medications or conditions. A quick note on testing. If you suspect you're deficient in vitamin D, a simple blood test can confirm it. It's always better to know for sure rather than guess. Your healthcare provider can then recommend the best course of action based on your individual needs. In conclusion, preventing and treating vitamin D deficiency involves a combination of sensible sun exposure, a healthy diet, and possibly supplements. And remember, regular checkups and blood tests can help monitor your levels and adjust your regimen as needed. Remember, your health is in your hands. With the right knowledge and actions, you can ensure you're getting enough vitamin D to support a healthy, vibrant life. To recap, here are the top 10 signs of vitamin D deficiency. These include fatigue, bone pain, muscle weakness, mood changes, and impaired wound healing. In addition, signs may present as hair loss, lower back pain, increased susceptibility to infections, and a decrease in bone density. Lastly, severe deficiency can lead to cardiovascular conditions. Stay aware of these signs and take action to maintain your health. Thank you for watching.